And I want to welcome everybody again to our channel in which we put women matters first, particularly issues dealing with menopause and menopausal issues, anything menopausal, even perimenopause. And the topic I chose tonight is menopause and our hearts and the effects that the estrogen may have on our heart as women, things that we take for granted. I want to want us to be aware and make comparisons to the various symptoms between heart attacks for men and for women. I know many of us can probably pinpoint someone in our lives who have had heart attack or issues with heart disease at some time. So I believe it's a very timely topic for us. Heart attacks, heart disease. Right, so I just want to see if one or two other people will come on, and I want to start the topic first. All right, so I want to start now. So we want to know if there's any relationship between menopause and heart disease. And I want you all can put up your hands or make a comment and say yea or nay if you think there is a relationship. Anybody think there's a relationship between menopause and heart disease? Do we think heart disease increases as we get older due to the decrease in the estrogen, particularly the estrogen? Right? Charlene says yes. Miss Logan says yes to everyone. Chanel says yes. No, she says maybe. Right? We're on the right track. Right. So there is a relationship between decreased estrogen levels and heart disease. This is according to the Victor Chang Cardiac Research Institute. Because I did some research in that. Miss Atwell said yes as well. Yes. Very good. So yes, menopause and decreased estrogen levels has a role to play. So does Camille. Yes, she says yes as well. Women tend to develop heart disease later in life than men. And we know basically the reason for that is because of menopause. Yes. Yes. Yes, again, from seen tracks. Yes. Yes, that is true. Yes. Right. So women tend to develop heart disease later in life. Yes, Cynthia said yes as well. Welcome everyone again. Largely because they have been protected by the hormone estrogen. You know, many of us, when we reach a certain age, we are so happy to get rid of this monthly cycle. But with the lack of or the decrease of estrogen and progesterone, particularly estrogen, there are certain risks that increase because estrogen protects our hearts. So, and as we go on with this topic, you would see, right? Largely because they have been protecting, our hearts have been protected by estrogen, which plays a crucial role in reproduction. But during menopause, most commonly, we know that this takes place sometimes in some women earlier than others, earlier than the age of 45, some women as early as in their 30s, even without any type of surgery or any type of medication. Some women have menopause in their genetics a little earlier a bit earlier than others. So generally speaking, menopause starts between the mid-40s and it goes on to the next extreme, to the mid-50s and sometimes later on. The body starts to produce less and less of this hormone, estrogen. Now, what estrogen does with the heart, it helps to relax and dilate blood vessels, which reduces, it helps to reduce inflammation, and it improves cholesterol profile. So that is another thing that affects us too as we get older. So the decrease in the estrogen level, which occurs during menopause, can contribute to a higher risk of heart disease. So yes, we were all right. Menopause can affect the body in several ways that impact our general health, including one that we spoke about just now, they're changing in our cholesterol levels. So menopause can lead to unfavorable changes in our cholesterol levels. It is common for women to experience an increase in what we call the LDL, which is the low density lipoprotein, which is cholesterol, which is often referred to as the bad one, and a decrease in the high density lipoprotein, which is the HDL cholesterol, often referred to as the good one. So these changes can affect and increase the risk of heart disease. It can also cause increased blood pressure. And what a lot of us women, we know that a lot of women, it is during this time in our lives when we find that we are diagnosed with high blood pressure, diabetes, and problems like that because of the effects of the decreased estrogen in our system and the relationship it has with our body, particularly tonight we're dealing with the heart. So menopause can be associated with increased blood pressure. Elevated blood pressure also is a risk factor for heart disease. Weight gain. Weight gain is another factor during and after menopause due to hormonal changes as well, which can contribute to heart health issues. Weight gain can also be associated with lifestyle changes. For example, if we engage in less exercise and we have less muscle mass density, which also decreases as we age, this can affect our metabolism by slowing down the rate in which our body burns calories. And ladies, we know that at this time in our life, that this is a very big issue. So your metabolism slows down because of the decreased estrogen, and the excess body weight, especially around the abdomen, starts to accumulate. And it is another risk factor for heart disease. What about increased risk of diabetes? The risk of developing diabetes, which is type 2 diabetes, increases with age and is further influenced by, again, hormonal changes associated with menopause. So diabetes is a significant risk factor for heart disease. Another thing happens too as estrogen levels drop, our blood vessels function differently. What happens is that the decline in estrogen levels can lead to changes in how our blood vessels function. Now, with the estrogen, when it's normal, where before we start to go through all these changes, it is more elastic, there's more elasticity in it, right? And it's more flexible. And you know, the blood can pass through easier and all of that. But because of the menopausal changes, the artery starts to become stiff and they constrict. And that is what helps to contribute to hypertension, which we know as high blood pressure, and reduce blood flow to the heart. We also have greater risk factor of what is called in the medical world as metabolic syndrome. Metabolic syndrome. Now, metabolic syndrome is actually a cluster of conditions that increase the risk of heart disease, including obesity, high blood pressure, high blood sugar, and abnormal cholesterol. So that is what we call metabolic syndrome. So the four culprits here are obesity, high blood pressure, high blood sugar, and abnormal cholesterol levels, which this is called metabolic syndrome. So what is another contributor to heart disease as well? We know that when we go through menopause, because of the anxiety and the insomnia, we have a tendency to sleep less. And that lack of sleep also increases our risk of heart disease. So less sleep. Let's see what that does. So the with menopause, with the decline of estrogen, we know it affects our sleeping pattern, especially in the perimenopausal phase. That is the phase before we actually go into menopause, which is, we know, it is 12 months straight without having any senior monthlies. Then you could say you are menopause, you reach that menopause stage. But before that stage, when the actual effects of the menopause has started, like the irregular cycle and things like that, you are still in the, once you've seen a monthly cycle, even though it's irregular, you are still in the perimenopausal phase. So we see that here that especially in perimenopausal stage, it can cause night sweats and insomnia. And research has shown that poor sleeping patterns lead to an increased risk of developing heart disease. So our aim is to get at least 7 to 9 hours straight sleep. Right? And as we discussed in earlier lessons, what are some of the things that we could do to help us to sleep better? One of the things we can do is to wear very light clothes. Hi Dale, welcome. One of the things we can do is wear light clothes. Have a sleeping pattern. Meaning that try to go to bed around the same time every night, so that you can build a rhythm, so that your body could get accustomed to that, and you could get the sleep that you so need at this time. So keeping your room very airy, and that would help you to be even more comfortable. Also supplementing with magnesium glycinate, which is very helpful at this time. It helps to help us when we cannot sleep, which I use. We take that. The best time I find it works, according to what I've researched as well, 2 to 3 hours before bedtime. And Miss Atwell was also reminding me as well. She said also massages as well help before you go to your bed, and a nice bath. Very good. I use that. Somebody say I use that. So you get, some people use massages as well, and some people also use, in combination, like me, use the magnesium glycinate. So these are some of the things we can do to help us to sleep better, because somehow our minds are so anxious around that time. We tend to have problems with sleep and anxiety. So what can we do to lessen the risk of developing heart disease during this time, during perimenopause, menopause, and postmenopause? So it is very, very important for women going through menopause to be very proactive, to take proactive steps to maintain and improve heart health. Here's some of the things we can do. We can never underscore the importance of regular exercise. That is something we have to really get into our regime. Regular exercise or physical activity can help control weight, improve cardiovascular health, and lower our blood pressure. So we cannot overemphasize the importance of regular exercise. Try to get in that at least 150 minutes of exercise weekly. And if you could do a little more, even better. So for those of us who haven't exercised for a long while, I always say, start small. A little 10 minutes. You start with 10 minutes every for the first week, then you increase to 20 minutes. And as the week go by, you try to put in at least 30 minutes at least 4 to 5 times per week. And and then you make up your 150 minutes of exercise. It is very important. So following a heart healthy diet as well. Remember last week we dealt with the Mediterranean diet and how it is important for heart health and general well-being. So those of us who weren't there last week, go back into that lesson with the Mediterranean diet and the importance of eating very clean, which is as natural as possible. A lot of you use a lot of olive oil, healthy fats, flaxseed, salmon, healthy, very healthy eating, cut down on processed food, eat more fruits, veggies, resting. We dealt with that whole lifestyle. So we know that it's actually a lifestyle change we really need to make. So following a heart healthy diet, eating a well-balanced diet that is low in saturated fats, which we know that the saturated fats would contribute to the increased cholesterol, and decreasing also sodium can help manage cholesterol levels and a healthy blood pressure. What about monitoring cholesterol levels and heart health? So what we need to do is go check, or what I tell all of my patients, buy a blood pressure monitor. Right? Have one at home. Some of us keep that for elderly relatives or elderly parents or relatives. And, we should, as we get older, we should keep one of those blood pressure monitors with us. And the range, normal blood pressure generally, the range we work at with is 110/70 to 120/80. Now, there's a school of thought as well that is going around saying as we get older, they prefer that it is a little higher than the 120/80. But the range generally is between 110/70 to 120/80. And some people, due to their body, how they may be small built or they may be very athletic, would have a lower than normal blood pressure, even lower than the 110/70. But the general range is between 110/70 to 120/80. So we try to keep a healthy blood pressure, which would help preserve our blood vessels. The amount of pressure that would be going through our blood vessels would be easier for our heart to deal with. So managing blood pressure and making lifestyle changes would help very much to decrease any of us from getting heart attacks and heart disease. A healthy weight, keeping our has a weight in check is very important here. So maintaining a healthy weight or losing excess weight can help reduce the risk of heart disease. And you might want to consider also eating less calories. And how you eat less calories? By cutting down on the simple carbs. We know that we have to cut down on all the whites, all the white flour, the white pastas. Some people want to cut out carbohydrates altogether, but that is not healthy. Your body needs carbs. But in a lower proportion now, as we get older, we need carbs just as everybody else, but at lower proportions, and increase your protein intake. And that is what would help us to maintain and, in many cases, lose the excess fat. A lot of steamed vegetables. I try to eat a salad every day. I try to have healthy my fruits on a regular basis. So blueberries are very good, especially at this age group. The berry family is very good. Oranges, grapefruit, pear, apple. These are, very, very healthy fruits to incorporate in our diet as we get older. So, and that would help to slow down the excess fat. What about smoking? Those of us who smoke. See smoking, if you smoke or if you vape, quitting is one of the most significant steps that we can take to improve heart health. Cutting back on alcohol as well can be a significant factor in weight gain, and it can also cause blood vessels to dilate, leading to increased body temperature and sweating, which can affect the already disrupted sleep pattern. So, ladies, those of us who use alcohol on a regular basis, it would be a good time to decrease the amount of alcohol we have in our diet. Right? So we said getting a good night's sleep is very important here. What I want to do now too is to make a comparison between how women and men deal with our bodies differ when it comes to heart attack. So I went and I looked up the various differences, how women and men, how the symptoms would vary between women and men. Now, anybody knows some of the symptoms that we women experience when we're getting then you think we might be getting a heart attack? Anybody knows?
Well, Elizabeth here.
Yeah.
I don't think I've never experienced a feeling of getting a heart attack, but I've heard from other people what they felt. They felt like they were losing, the normal way of their thinking, like losing, consciousness.
Okay.
They felt as though they felt like some pains, like some acid burns, that kind of thing. And it wasn't really that. And they thank God they live to come back and share, with other people. One person told me that they felt like pain radiating from what we will term the heart area straight down into the side, that arm that is on the same side of the heart. Because the heart has a leniency of being more on the left side. So they felt pain like radiating down into the arm. Some people said that they felt a sort of a shock, a sort of a shock from the head into the chest, that kind of a feeling. So those are the experiences that I've heard that some people spoke about before they actually got a heart attack. Some people said that they had a diarrhea, they wanted to pass urine more regular, all those things.
Okay.
Yeah.
Okay. Right. Anybody else? Now, do we know that the symptoms vary? Some of the symptoms vary between men and women. And I want to let us be aware of that. They vary. Now, we are similar in the sense that the common symptoms of heart attack for both men and women is the chest pain, right? But women may experience less obvious warning signs. So let's look at the symptoms for men. Men, they have the nausea or vomiting. The women, they have the nausea and the vomiting. Men, generally, they have the jaw, neck, and the back pain. Women have the jaw, neck, or the upper back pain, which is between the shoulder blade. Men have that squeezing pressure in the chest. Women have chest pain, but not all the time, not always. Men have a lot of shortness of breath. Women have pain or pressure in the lower part of the chest or in the upper part of their abdomen. And they may also give and take shortness of breath. Women also tend to have fainting, and many times, and I want us to take this one into consideration too, many times a lot of women have indigestion. Sometimes they say, I eat some, I think it's gas I have, and that gas is, sometimes it's not a normal gas, it's a gas that lasts for in some cases, several days, and you're thinking, it's just a gas pain I have. If you have a gas pain that is consistently continually going on and on. And you drink, we in the Caribbean here, we drink something hot, and the gas seems to be there still. Go and get that checked out. Don't say, all right, it's just a gas pain. It could be an early warning sign of a massive heart attack coming on. Also, extreme tiredness. So it may be a combination of one or more of these symptoms. So women all tend to have, in many cases, something more gastric as well, along with some of the other symptoms. So it is something we take note of. So, what would we do in cases like that? In Trinidad and Tobago, we call 811. That's the number we call for an ambulance emergency. In the States, we know it's 911. So it is important, that you have that, you be aware that, you have that number close by, or, in case, to dial on your phone, readily available to call in case of anything. And in many cases, an aspirin under the tongue, if you start to feel the effects and you believe that you may be having a heart attack, would help very much until you reach the healthcare facility and you get your care started. So it is important for us to note, and I made note again, I want to make note of the various differences. Men, nausea, vomiting. Women, similar nausea or vomiting. The men, jaw, which is usually the left side jaw, neck or back pain, squeezing chest, pain, shortness of breath. Women, jaw, neck, and upper back pain, that is between the shoulder blade. Chest pain, but not always. Pain or pressure in the lower chest or the upper abdomen. Shortness of breath. Fainting. Indigestion, that is the type of indigestion. You're feeling this gas pain and it's not going, it's lasting for a number of days. Get that checked out. And extreme fatigue that is just continual. For you're not exercising or you're not doing anything, you're just there and you're extremely tired, you're not anemic or anything like that. Get yourself checked out. Go and get you to the doctor and get yourself to see what may be causing these disturbances in our bodies. So, anybody would like to add in anything here before I continue? Because even if we see a family member that, maybe showing some of these symptoms, it's very important that we take note and we have that information readily available. Sometimes we take things for granted that, that's, I don't think that's happening to me. I eating, like drinking good. I having a regular, everything is normal. And so, I don't think that is going to happen to me, but we don't know. Sometimes we just don't know if because stress is a factor when it comes to heart disease as well. So we need to be aware of that. So if we're doing a lot of this stuff good, we're doing everything that we're supposed to do, and we're stressed out, it can cause hearts to be at risk. So,
Miss Maria.
Yes, my dear.
Good night. What
Miss
about a regular check with your doctor so that you can have your bloods done, so that you'll have a good idea of your cholesterol and all those things, so that
Yes.
in the event that, anything, you tell yourself, well, look, if you're prone to, or, that kind of thing.
Thank you. I was about to say that, but thank you very much. Right? So because I was
You're
now going
welcome.
on the and that issue, on that particular point. Thank you, Ms. Eli.
You're welcome.
Yes, thank you. So getting your regular check, especially at this age group, ladies, go get your regular blood test, which check your um your heart, check your cholesterol levels, things not to, we don't need to don't take these things for granted. As I said, some of us say we're eating good, we're drinking good, sometimes you're not sleeping well, and you're stressed out, and with all the and all the issues that is happening during this transition, it can cause us to get a heart attack, right? And so know the signs, know the symptoms, and share the information as well with others, because women younger than this age group as well tend to get heart attacks as well. So having a healthy lifestyle, eating well, resting well, all of these points that I gave earlier would be aiming for better health and management of weight as well during this time. All these things work together. So what I'm basically saying, it is a lifestyle change that we have to get accustomed doing if we want to live a long and a healthy life. You don't want to live a long life and always have to go to the doctor because there's always some issue. You want to be healthy and be able to enjoy all the hard work and the fruits of your labor after working all this time. So it's very important that we take our health in our hands, ladies. Somebody, you can say something. Somebody
Hi,
raised their hand. Yeah,
But
hi.
this,
good night,
okay,
everyone.
Good night, Anne-Marie.
good night.
I actually suffered a massive heart attack 2 months ago.
Oh boy, sorry to hear that.
Um,
Thanks for sharing though.
and they call it, it was a left lateral STEMI,
Mm-hmm.
which means the small vessel in the heart, where the heart will deal with the oxygen, it
Yeah.
end up bursting. No, before that happened, what I think we have to no, I suffer with fibromyalgia, and most of the times you'll be a little sluggish. I
Mm-hmm.
also suffer with a clotting disorder, so most times your blood will feel a little sluggish. So
Okay.
even the symptoms was coming on, I wasn't really taking it to get that kind of report. Um, the sluggishness, I was
Mm-hmm.
very sluggish.
Mm-hmm.
I actually told a friend of mine a couple a couple weeks before that I
Mm-hmm.
feeling like something is happening. I'm not feeling myself, and I feel like something massive is going to happen. I
Wow.
didn't think that the massive I spoke about would have been a massive heart attack. Um, on the onset of the heart attack, because
Mm-hmm.
the morning when I got it, the Sunday morning, um, I felt this gripping, like somebody have on a glove with spike on it, and was literally
Mm-hmm.
ripping my heart out of my chest. It's not a nice feeling at all.
Wow.
Um, as I tell people, a lot of people, that's why I realize a lot of people don't survive to talk about a heart attack because
Oh, bless.
is a worst
Hmm.
feeling in the world, literally.
Hmm.
So that gripping feeling, and
Mm-hmm.
the first thing that I think I grabbed for that I had was a muscle relaxer because I didn't know what was happening.
Mm-hmm.
Right now, I had slight shortness of breath, not something that was alarming,
Yeah.
and it took me, well, the day move on, and it hit me again. It waked me out of my sleep 2 o'clock the next morning. So
Oh.
the thing is, as somebody asked, if you get that pain in your chest, why didn't you go to the hospital one time? The thing is, I go through so much things, and it didn't really move me to say, well, hey, I need to go. This even though the pain was different, I still did not move. So
Hmm.
if I got the one in the morning and I get it, it wake me back up. So it was really caused by, that's why what you said. Now my sugar level was high, and I wasn't seen about it, and
Okay.
literally my cholesterol was high. So that's two of the main things that
The risk factors.
literally cause the 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 problem. So it wake me up the 2 o'clock the next morning, and ambulance they had to take me. So when I hear reeling on the chair and hearing massive heart attack, was like, I ask myself, am I still alive? Am I still alive? Am I hearing right? So literally something that not supposed to take lightly.
Yeah.
It's supposed to keep you because because of that, my lifestyle has changed. um Cut down the grease, the soft drink, eating a lot more protein things, cut down a lot of things that I was really just throwing up in the air and not really paying attention to. So I love the topic. So that's
Okay.
my thing. So I lived it.
You lived it. I'm glad that you are here and that you were good enough to share the information because it is a serious topic. And that you are here to give up of your information so that you know that it is a real thing. Because many of us, I could tell you, I know women who have had heart attacks and didn't make it. So you're very blessed and fortunate to get another chance to make corrections in your diet. So thank you very much for sharing. We appreciate that. And I wish you all the best in your future endeavors as we all are aiming for better and better health. So lifestyle changes, ladies, as we see. Yes, everybody appreciates you sharing the message, Miss Ramona, Miss Anne Marie. So it is a real thing, ladies. Something for us not to take for granted. And we're hearing a story from one of our survivors here with us online here. And so it is something that we don't take for granted. She said she didn't really take it on for a while until it came back 2 o'clock in the morning and realized it was something really serious, that gripping feeling. And as I said, with some people, it doesn't all manifest, or the symptoms doesn't manifest itself the same way. So that's why too, I made the comparison. So a lifestyle change is vital, ladies. If you know we're still playing around, now is the time. While as the old people say again, I always say this in our program, prevention is better than cure. So let us start to get things in order. All the sort of fried food and the soft drink and the all the all the unhealthy snacks, the cakes, biscuits, all the sweetened stuff, all of these are contributors to our hearts being unhealthy, along with what we are going through at this time with menopause. So the onus is on us, Miss Atwell.
Yes, going along with the talks and so on, I wanted to ask some questions, but being a certain people say certain things, it sort of answer what I was about
All
to
right.
ask. But I want
Okay.
people to also understand that sometimes, according to Anne Marie, sometimes you can have a heart attack, and she mentioned something about a massive heart attack. When a massive heart attack occurs, you do not survive it most of the time. That's why, hence, it's called massive. Sometimes, right, like Anne Marie's case, um, she got signs, right, and she ignored the first time, and then with the second time, with the same feeling, she realized, well, something is going wrong, and that's where she took stock of it. Now, if she didn't, take care of herself at that time, probably a third one would have come along, and she may not have made it, right? So, obey the signs. Some people, you will ask, well, how did she, meet her demise and so on? And they will say, well, as far as they know, they didn't get any signs and so on, right? But actually, you get signs. That's how, when I was talking about the massages and so on, that's one of the things that I wanted to really talk about also. You get signs, and especially with the circulation and with our age. Remember, we slow down a lot. We are not as active as before, right? And we will have enough time to feel the difference. We live
Yeah,
the
exactly.
years to feel the
Yes.
difference. We
Yes.
are going to feel the difference. We must feel the difference. If there's a clot, if there is this kind of a heavy cushion feeling, as opposed to when you was okay or when you was younger, you know, you never used
Yes.
to get those feelings. But when you get
Mhm.
a feeling, especially when
Mhm.
you reach this type of age, you need to go and deal with it, whatever time it is, in the 24 hours. I also wanted to raise the point with, I remember sitting in some lectures with some doctors, and they were saying, it's okay to take like a 81 milligram of aspirin, you know, if it's every other day, twice a week, and so on.
Yeah.
So, if anybody wants to kind of help me share with that, or nurse might be better able, or even Dr. Khan might be better able to say if it's okay, because it's an OTC, which is an over-the-counter drug, right? And we probably could go and buy it. We could buy it, you know, but I would like to find out if it is, we can go ahead and use, you know, the 81 mg, if it's 3 times a week and so on, with our age.
Yes. I spoke about that just now as well. 81 milligram. In some countries they don't have the 81, they have the 75 milligram, but you take at least you take one every day. From some research that I saw, they say from the age of 40, we actually supposed to start to take that to make sure that our circulation is good. The 81 milligram of the aspirin, it really helps, right? I seen Dale had her hands up.
Yes, hi, good night, everyone.
Hi,
I
good
wanted
night.
early on, you said, we should do regular checkups and so forth. Should these regular checkups be at the premenopausal stage? What age range would you recommend? And when you say regular, how often? Maybe 6 months, a year?
They say yearly. From what I've been reading, from the time you hit the perimenopause, you start to see these signs and symptoms. Your periods start to become irregular. Remember, your estrogen levels starting to drop now, and you know that it's a time when we're more at risk to get these heart disease and we're more at risk. So from the time even before that, I take stock of our health as as women, because we see about everybody, and many times we put ourselves in the background. So it's more than time that we get that our act together, and start to look after ourselves, ladies. It is not being selfish if you start to look after yourself. Actually, you're doing yourself and your family a good. So, get ourselves in order. As Michelle just said, she really needs to start exercising. And there are a lot of programs that you can start. But what I would like to interject here, we lose a lot of muscle when we reach, from the time we reach, especially from our 30s onward, we lose a lot of muscle mass, especially as we continue in our 40s, and as the older we get, we lose more. So it is important that we start some form of weight training. It helps to build more muscle, and the more muscle we have, and research has shown when we have the stronger the legs, the longer you live. That is some research I was reading on some time ago. Strong legs, strong muscles in the legs, whole body generally, but particularly in the leg, people tend to live a longer, healthier life. So those of us who think weight training and lifting weights is for men, that is not so. That is a long time way of thinking, an old time. Weight training, weight lifting is very, 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 very good for us, especially as we go through this process. It's something that beside walking, lifting weights, at least twice a week, it is very, very helpful to help
Yes,
build
I
the
also saw that recently, like those endurance exercises,
yeah.
like you're doing squats with some weights and so. I
Yes.
saw that recently.
So that is another way, thanks, Ms. Dale, that is another way to protect our hearts as well. So we have to be wise out here, right? We have to be wise, and I always say your health and my health, our health is our responsibility. So it's not just to look good in clothes and aesthetically we looking nice, but it is generally for your general well-being, ladies, and to protect you from these diseases that is just waiting to kick in. So keeping our cholesterol in check, our yearly checkup. You know, if like Miss Anne Marie, who had the experience with the heart attack, her checkups would be a bit more regular, right? But for generally speaking, on a yearly basis, we go in and we do all our blood checks, cholesterol, you know, and we go and get your regular checkups on a yearly basis, especially as we go through this transition, knowing the risk that is there as the estrogen levels drop, ladies. And encourage each other. We as women, we encourage each other. Walk, you know, if you can't get, you know, you find that you don't have that drive, pull somebody in your family with you, a friend, somebody, and you know, start walking, start even doing it at home. Because there are a lot of programs online, as I was saying earlier, and if you get 10 minutes walking on the spot, something to move. We are made to move, not to sit down all the time. You know, after you have a meal, you know, we tend to lie down, get up and take a little walk around the place for circulation purposes. So, you know, this is the topic for tonight, and I believe it's very timely, and I want to thank everybody for all the contributions that they have been making to the program, and to, you know, it helps us to be more aware and to be mindful of, you know, some of the risks looking and the things that we could do to improve our lifestyle as women going through this process. So anybody else has anything to say before we close off on this topic? I want to thank particularly Miss Anne Marie for her contribution tonight.
One of the,
Good night.
oh, God.
I'm sorry.
One of the things I want to reiterate to,
Mhm.
stress.
Stress.
Keep the stress level down. Very important.
Yes, I agree. Stress is one of the main factors. Sometimes you're doing all the right things, as I said earlier on as well, and you're stressed out and your heart says, see me, I just tired, you know. Stress would increase cortisol, and you know, with cortisol, when it's increased, inflammation is increased. And you know, we're at risk again for getting a heart attack. Sharon, good night.
Hi, good night. Good night, everyone. I just wanted to add about the lady who got the heart attack as well too. We tend to self-medicate too sometimes. We tend not to so what we do, we suppress the things that we know and we feel that is happening in our bodies. We know, remember, she said she got earlier signs and she knew that something big was coming. And we have to learn our bodies, and we have to learn that this is not natural, it's not normal. And sometimes what we tend to do, we take two Panadol. Or we take something to suppress what is happening. And then we leave it at that. And then 2 weeks go by and then you get it again. And then we take some aspirin or we take something again and we suppress it. And we talk about exercising, but it is also very important that when we feel like that, we have the health centers, we have all these places.
Yes.
If it is that a morning you're going to work, you pass and you go in the health center and you find out what is happening. Look, I'm having these symptoms. It's coming, it's coming, it's going, it's coming. And, you know, so we tend to wait till it reach a point where we cannot control it, or we on the last. And then we tend to still want to deal with it. You know, so for all of us, we have to know our bodies in terms of that. This is nothing. This normally don't happen to me. Why is it starting to happen? I had that experience too, where I mean, all the things that we spoke about before, you know. And so now for me, anytime anything strange started to happen to me, believe me, I by the health center or finding somebody or you talk to somebody and you say, listen, this is happening to me,
Yes.
and get the help. We need to get the help. We need to not just sit down and say it go pass. Especially as we're getting older, we need to be proactive and find, sometimes money is hard, but we have the health centers and then they could refer us to the hospital, and if it's something more important, but we have to act. That is so important, that thank God that she survived and she's here to talk to us about it.
I'm
But
so
we need to be proactive. We need to just, I get up my leg for some reason, your leg not working properly. It has to be a reason, circulation, whatever it is. You take a little cayenne pepper or you take a little something because you figure, well, that will help us. But the issue is still there.
too much self-diagnosis.
That's just my little contribution. Yes.
Thank
Okay.
you. Thank you. Thank you very much, ladies. So again, I want to thank Ms. Anne-Marie for sharing such a timely topic and for being so personal with us. And to her, I want to wish her continued good health and continue gaining better and better health. And for us as well, ladies, we see it's a real thing, that we take check in our own lives as well and start to do what is needful so that we could have a healthier lifestyle. And as I always say, I realize the food we eat now is not like the food we were eating when our parents was eating. To me, that the generations before was stronger because the food was better. It didn't have the amount of chemicals. But the knowledge we have now is more. So we know what to avoid and we should, take these things into consideration as well. So thanks again for sharing. Thank you, ladies, Miss Anne-Marie, and for everybody else who was listening, and also those of us who contributed to this timely topic. So again, the onus is on us, and to get our health in check, make small changes could make a big difference generally in our bodies. So have a blessed night, everybody, and thanks again for your contribution. Until next week, Tuesday, looking for another timely topic. Thank you very much, Michelle, for coming on. Thank you. Thanks, ladies.
Okay, good night.
Blessed night, everybody.
Night.
Good night, ladies.
Everyone, thanks.
You're welcome. Welcome, Charlene.
Good night, Maria.
Good night, Cynthia. Good night, ladies. Bye, Elizabeth. Thank you. Blessed night, everyone. Have a safe night until we meet next week again. God willing, for another topic.
Good night.
Good night. Good night. Carmen, Lynette, nice new people, new faces. Thanks again for coming, ladies. Michelle, everybody. Thank you, ladies. Good night, everybody. Miss Eli, good night.
Bye.
Night.
Good topic. I enjoy it.
Thanks. Same here.
Okay, bye-bye.
Bye-bye, ladies.